Uh, I'm happy to welcome and also appreciate our resource persons who actually impressively turned in even before and ahead of our participants, and also the moderator on behalf of the organizers of this webinar, which is the second one convened by Juris and Header Resource Center for the purpose of engaging the institutions of government responsible for managing the COVID-19 pandemic situation and also providing responses to the emerging situation. Vis-a-vis, most importantly, around transparency, accountability in the management and utilization of donations, resources, and supports. The purpose of this is basically to empower most of stakeholders in both accountability sector, the good governance, and also those that are involved in the health sector to understand some of the technical issues that revolves around the management of fund relief packages. And it's becoming increasingly clear from experiences and also developments around the country based on media reports and also some of the research findings of civil society organizations that our civil servants, public office holder, and politicians are not in any way willing or ready to even change in their ways of mismanaging the natural resources, the common patrimony, and even contribution and pandemic situation is already becoming also clear that Nigerians, politicians, and civil servants are more interested in benefiting or exploiting the misery of Nigerians for personal benefit and not responding to the plight and challenges of Nigerians for the betterment of their well-being or even improving on some of the challenging situations, social, political, infrastructural. And that is why our response to the health situation is not meeting any serious response from the responsible organizations, institutions, governments. It is rather unfortunate that we have such terrible situation at the federal level, and the state level are even worse than what we have at the federal level. And the local government is a complete aberration such that we don't have any functional primary education health system. The educational system as well is not getting any form of support, and you can check and confirm that most of the so-called e-learning that you have around the secondary and primary schools are more in the urban area and also private schools. The public schools are yet to catch up. The children of the ordinary people in the rural area are not even having the chances of ever benefiting from anything close to what we call the e-learning system. It is on this note that we've brought eminent personalities to shed light on some of the topics that we have identified and also considered very important in not only identifying critical issues that are missing in the responses of governments to the pandemic situation, but also the ones that we think are very necessary for consideration going forward. Once again, I'm going to hand over to the facilitator of this meeting, Professor Deji Akinleye, to midwife the process, like he's more than eminently done before now, and also coordinate some of the contributions from the participants. I thank you very much for this.
Thank you very much, Mr. Suraj. Welcome to everyone. This event is in in a sense, a follow-up to an earlier event on transparency and access to information that the HEDA organization, along with its affiliates, organized some months back. And the concern at that time was the fact that the anti-COVID regime was not just opaque, but gave room to a lot of corruption and lack of accountability. And I think at that, one of the fallouts of that event was the suggestion to monitor further some of the initiatives that had been mapped out by government, and also to look at the possibility of coming back like this in order to note whether things have improved or indeed whether we still need to examine ways by which we could make public officers and responders accountable for the financial resources, huge financial resources that are being expended by governments in this fight. It is not a program that is focused essentially on the COVID era, on the COVID-19 era. As you will see, a lot of the consequences of what we are doing now will be with us for a long time to come. And it's really apt that we have this assembly of speakers. I'm very pleased that HEDA was able at quite short notice to get this array of experts. Mr. Ogunsanwo is a foremost analyst. He has worked not just with all crusaders, transparency crusaders with the bar in identifying so many issues that needed analysis. And he will be talking to us about the politics and statistics of COVID-19. Dr. Biola Akeode Afolabi is also quite known as a versatile scholar, researcher, and campaigner, anti-transparency campaigner. And she will be reviewing palliative measures during the COVID-19 era. Our third speaker is Professor Usongara Odambana, who is a professor of international law and also constitutional law. And his beats will be to look at federal, state, and local government relations during the COVID-19 fight. And lastly, we want to know whether any lessons have been learned at all by Nigerians. Will things have been done better? Will things have been done better, whether from a constitutional aspect or from even a governance aspect? And one who has identified with the way things properly should be done is Mr. Muade Gorua, the senior advocate of Nigeria and also a committed transparency advocate. You are welcome. So in terms of ground rules, we will start with Mr. Ogunsanwo, who will talk to us about the politics and statistics of COVID-19. You have 15 minutes to do your bits, and the time starts now. Mr. Ogunsanwo.
Thank you so so much. That makes me feel like I'm on the Who Wants to Be a Millionaire seat. The first thing I'd like to say is that Nigerian citizens, and indeed citizens in other parts of the country, spend currency. I'd like to speak particularly about Nigeria, and that is, as citizens, the currency we spend here is called the Naira. But we're at a point where the government is making a mistake, thinking that their own currency is as well called the Naira. No, the citizens' currency is the Naira. For the Nigerian government, their currency is transparency. Here's what I mean. As citizens, everyone on this platform spends Naira, and so I expect that as normal, we'll all have some Naira savings in our accounts because we are thinking about the future. For the government as well, their own savings should be savings based on how transparent the government is running their operations, because the government's real currency is not the Naira. The Naira is for the citizens to spend. The currency of the Nigerian government is transparency. And research locally and internationally points to evidence that the Nigerian government is running very low on its currency. And just as we understand, whenever we are running low on our own currency, the Naira, we know that it's time to panic. Imagine having zero balance in your Naira account. The Nigerian government is close to having a zero balance in its transparency account. I'd like to start by looking at the politics of the COVID-19 data. Looking at the Nigerian case. The Nigerian case, yes, we've seen the numbers from the NCDC. As of this morning, the NCDC says since we had the first case reported on the 27th of February, we now have 26,484 cases. The good news is not all of these cases are still active. Thousands of Nigerians have been discharged, and at the moment we have 15,729 active cases, approximately 16,000 active coronavirus cases in Nigeria. But that is what the news is telling us. I'd like to talk about what the news isn't telling us, and that is talking about the difference between the survival rate and the fatality rate. Presently, 98%, and I think you heard me right, 98% of everyone that has had the coronavirus in Nigeria is alive. 98%, which means that 2% of those that have had the coronavirus have passed on. Another way to look at it is the number of deaths, which is, we have 616 people, 616 people have passed on. And a lot of government agencies, the Nigerian Center for Disease Control, the federal government, the Presidential Task Force is saying that it could have been worse. And that if not for a lot of the donations and the interventions that Nigerians who perhaps will have seen thousands and thousands of deaths. But recent research that I've done shows that yes, the NCDC, the Presidential Task Force, and some of those monies have helped to reducing the spread of the coronavirus. But there's a more important factor that has led to fewer deaths in Nigeria, which is what I want to talk about. And research shows that the most important factor that has led to fewer deaths in Nigeria is our demographic. By demography, I mean that the WHO, the European Center for Disease Control, say that based on their own research, that individuals that have the highest impact that are highly impacted by the coronavirus are the elderly, especially the elderly that have underlying health conditions. And so let's talk about the elderly in Nigeria. In Nigeria, only 3% of Nigeria's population, only 3% of Nigeria's population live to celebrate their 65th year-old birthday. In the United States, 16% are above the age of 65. And so, based on pure demographics, we can see that a lot of Nigerians that would have been highly impacted by the coronavirus have been killed by something else. Nigerians are not living to the age of 65. Very few Nigerians are falling into that elderly bracket. Compare that to the United States, where 16% of their own population is above the age of 65. And so, yes, the Petroleum Task Force, the NCDC, the awareness, and all of that news that are going out has assisted in some measure to minimize the spread of the coronavirus. And once the spread of the coronavirus is minimized, yes, the number of deaths will also be minimized. But what has really been the most successful thing in Nigeria is that, and again, it's an irony, and that is only 3% of Nigerians live above the age of 65. And so when we watch the news and we see the bad numbers from a lot of developed countries, especially the United States, there are 3 reasons why their numbers are that bad. The first reason is the United States has a larger population than Nigeria. The second reason is many more families in the United States are older than Nigerians. And the third reason is because they are older, many more families in those developed countries have underlying issues. So before any government agencies takes all the glory, let's understand that Nigeria's demography has played an important role to why a lot of Nigerians are surviving and are not dying from the coronavirus. The second thing I would like to talk about is to look at the spread of COVID-19 in Nigeria. We've seen that from the 27th of February when the first case was reported. By the end of March, we had 11 states, 139 cases. On the last day of April, we had 34 states and 1,932 cases. And May, June, we've seen every state in the country, except for Cross River State and Kogi State, that have been having a big battle with the government on the number of coronavirus cases. Indeed, as of today, Cross River is the only state in the country that says that they still do not have any official case of the coronavirus. But here's why I find the case of Cross River very, very funny. I've studied all the states that Cross River has, that shares boundaries with. Cross River shares boundary with Ebonyi State. Ebonyi has reported 438 cases. Cross River shares boundaries with Benue State. Benue State has reported 65 cases. Abia State, another state that Cross River shares boundaries with, Abia State has reported 351 cases. Akwa Ibom, 104 cases. Cross River State also shares boundaries with Cameroon. Cameroon has reported over 12,000 cases. So it's interesting that Cross River still maintains a position that there are no cases in Cross River State. It's either the government knows, the governor or the government of Cross River knows something that the rest of the world needs to know. We've also seen within, as at this morning, the total number of samples that have been done in Nigeria are 141,525. That sounds like a big number until you understand that in the United States, they have a testing capacity of over 400,000 persons per day. In Nigeria, we've tested only 141,000 people since the beginning of the coronavirus. It even becomes even worse to understand that half of the tests in Nigeria were done in the last four weeks. And so the simple equation is the number of cases can never exceed the number of samples taken. And so if we've taken only 141,000 samples, clearly the number of cases officially reported can never exceed the number of samples taken. And based on global standards, Nigeria has not yet scratched the surface of testing to clearly be able to determine the accurate number of coronavirus cases in the country. But here's what we know, even though we do not have sufficient basis to accurately say that these are the number of cases in Nigeria. What we know is based on the samples that have been collected so far, the infection rate in Nigeria is getting worse even post-lockdown. What do I mean by the infection rate is getting locked down? If we look closely at what is on the screen, between the 31st of May and the 6th of June, we collected a little over 14,000 samples, and based on those samples, we recorded 2,378 cases. In simple terms, 17% of the samples that were collected came out positive. 17% of the samples came out positive. The following week, June 7th to June 13th, the data shows that things got worse. 21% of the samples taken in the week after came out positive. And the same thing happened between June 14 to June 20th when we collected 20,651 samples. Another 20% of those samples came out positive. But what happened between June 21st and June 27th? The data in front of us shows that 30% of samples taken are now coming out positive. In other words, 1 out of 3 samples taken now come out positive. So what this allows us to understand is, despite Nigeria's low standards in testing, the NCDC had promised that by the end of this month, in July, by the end of this month, Nigeria will have tested 2 million people. We've now only tested less than 150,000. Clearly, I say very confidently that it will be impossible to meet that target this month or next month. And because the number of samples taken, and whenever, like I mentioned earlier, whenever the number of samples taken does not exceed, number of samples taken can never exceed the number of cases recorded. Finally, there is a super pandemic that could be coming if strategies do not change. What do I mean by the super pandemic? A super pandemic occurs when the number of patients that have the number of individuals that have the coronavirus, the number of new cases are higher than the number of people leaving the hospital, because then there'll be fewer bed spaces. And so what we've seen in the last 4 weeks, consistently, in each week, the number of new cases that we're recording each week in Nigeria, the number of new cases we're recording is significantly higher than the number of people leaving the hospital. In simple terms, the number of cases recorded each week is greater than the number of cases we're discharging. That has a severe effect when you accumulate it. And so in the last 4 weeks, the summary is we've seen more than 14,000 new cases in the last 4 weeks, yet less than 5,000 have been discharged. If these trends continue, then a super pandemic could be on its way in Nigeria. In closing, I'd like to share a statistic that I think is very frightening. And that is what the NCDC released last night, which provides more information about the number of active cases. I've talked about, as of today, we have 15,729 active cases in Nigeria. That's the figure we have as of today, 15,729 people that still have the coronavirus in Nigeria. But here's the challenge. 82% of those active cases are in the southern region of Nigeria. So it makes us ask the question that 82% of active cases are located in southern Nigeria. It makes us doubt the accuracy of the numbers coming from the north. And how come 82% of Nigeria's coronavirus cases as of today are in the south? Yet, the last census shows that the north has a higher population. The last report from the National Bureau of Statistics shows that household size is larger in the north. The last literacy report and poverty report shows that poverty and illiteracy are higher up north. Yet, the number of active coronavirus cases is disproportionately higher in the southern region of Nigeria. This data perhaps allows one to nearly conclude that the number of cases in the northern regions of Nigeria have been understated, have been underreported, and have been unexplainably low. This might be due to the politicization of the coronavirus in the northern region, or this might be due to the fact that the number of samples that have been taken since the beginning of the coronavirus has also been significantly low in Nigeria. And clearly, if you go onto the NCDC's website to be able to find out the accurate information on the number of samples that have been taken in each state, that information is almost nearly impossible to find.
Thank you, Jide. That has been wonderful, brilliant expose. You raised a number of questions. That's what I like usually about your analysis. It gives you show more that a lot of us have probably just assumed. I think we'll come back to you later during the questions and answers. I particularly want to know what role you think the palliatives or the grants that the federal government decided to give states. Do you think it played any role at all in the way the statistics came out? I think we'll come back to you later. For now, let's us welcome Dr. Biola Akiode Afolabi, who will be talking to us for the next 15 minutes about combating corruption from the perspective of palliative measures during this very, very troubling season. Dr. Afolabi, you have the floor. Dr. Akiode Afolabi. I think you need to unmute her. She needs to be unmuted. Yes.
Okay. Good. All right. Thank you very much, Prof. And I want to thank EDA for their consistency in this conversation about COVID-19 and the aspects of corruption. Well, I'll just start first by doing some form of reflection about the whole gamut of discussion about the anti-corruption war in Nigeria, and the fact that this appears to me as a litmus test of whether those assertions about the government's political will or support in fighting corruption is working, or the fact that it's not effective. And I think that from what we are gathering from conversations, because there are principles surrounding anti-corruption, which are very basic, which has to do with transparency, accountability, and a whole lot of issues. One can see that some of those are missing. When the government launched the so-called anti-corruption war, they started with several strategies. They talked about single treasury accounts. They talk about a whole lot of other things that ordinarily. ICPC had a scorecard, they have risk assessments and all of that. So I'm saying that there were a lot of things on the papers, on the paper, which ordinarily should have strengthened our capacity as a country, before the outbreak. And that should have helped in terms of how we manage COVID-19, the fundings and the palliative and what have you. When this whole thing started in April and there was lockdown, Eda and Watsi had a conversation, and I think Professor Senua was also involved in that conversation. And when there were promises of palliative that would be distributed to people, and in terms of cash and also in terms of food items and all of that. If we remember in the early days, in April, we had a situation whereby some palliative were given to some people, particularly in Lagos, in Agege, and we saw boys on the streets using that bread that was given to them as football and all of that. And I remember that myself and Suraj sat down and said, well, one thing that is clear is that maybe the palliative was actually given to the wrong group of people, because it was obvious that they don't even need the bread, no matter, what that conversation was at that point in time. And that made us thinking that maybe there is a need for us to strengthen our conversation in terms of following, every step of it, so that it becomes then possible for us to be able to issue a report, from the citizens' point of view on how the entire COVID-19 responses, were going. So we started with, in April, targeting about 2,000 beneficiaries, across the country. Respondents rather, across the country, with a survey asking them about their perception of corruption. Now, one of the things that came out from that first survey was the fact that people don't even have the information about, if you want to monitor whether a particular situation is corrupt or not, we also need information about what is being put on the table. So it was obvious that, there was no information to even track, or monitor or know, what the government is bringing out and what they expect the people to get. So we went further because we then knew that this would probably affect, because we had some series of webinar. And one of the things that were coming out from that webinar was the fact that this would affect the indigent people the more. So what we went further, being the fact that we work with a constituency of women to do what we call the Gender Rapid Response Survey. So the survey was to target, and we targeted about 7,000 indigent women across Nigeria, across about 10 states, in Nigeria. And what we did was to look at the socioeconomic demography to sort of first find out what are the coping, and that was a question about how are people coping? Because if you are being locked down and there's no preparation whatsoever in terms of social security of welfare of the people, then it becomes important for us to know what are the coping, mechanism. Your guess is as good as mine. How people who are already doing 001 had to turn to 00 half, to be able to survive during that period. I remember at that time, we also got information about increase in gender-based violence. And we sent out, we started like a radio program, asking people to report gender-based violence. And we ended up having about 200 people sending us text messages to say, well, gender-based violence, yes, but we need to eat. And people asking for food, to show how bad the situation was, for Nigeria. Now, one of the things that the survey also looked at was the knowledge of coronavirus. We realized that apart from the elite who could talk about some few things related to coronavirus, the people in the community feel that it is not real, it is not happening. And that is why the fear of when coronavirus gets into community, becomes much more real, and the implication of that on the country. This morning, yesterday, I think, the Secretary of the Nation, boss, was talking about people, all of us go spiritual, beyond finding the solution. So, so it shows the deterioration in the system in terms of their capacity to be able to address the issue. So we also look at the livelihood and income, and we realize that people from the informal sector really suffered, more, because they rely on a day-to-day income generation, and that was not happening during this period. Then we look at the issue of household. How has this affected the decision making within the household? You know, we look at the health services in terms of are people having access, and a lot of people shun the health services because of the fear of coronavirus. We look at issues of mental health, and we could see a lot of that, you know, happening with the kind of gender-based violence that we saw, you know, during this period. Security, there were issues about 1 million boys and all of that, you know. Now, in terms of the issue of corruption in the palliative, there are 3 major issues that came out from some of our findings. One is the issue of transparency in leadership at all levels, you know. And, you know, if there's transparency in leadership, that will help in terms of providing well-informed public. So because people don't even know and they don't have any information about how much is being given, you know, created, you know, a major, you know, gap in terms of, you know, people even knowing whether they are. We had a situation whereby you have a task force which was set up and does not cover the sector of the society. There's no civil society, there's no people with disability, you know. So in terms of one task force, understanding, you know, the need of the people became a major problem. So we saw the question of inclusivity. For example, in our research in FCT, the FCT, the Minister for State of FCT came out clearly to say, these are the palliative, we have trailers, we have this number and all of that. And then within a period of time, invited some civil society who came back to say, well, we didn't know what happened. We were at the place where it was being shared, but at the point in time, we just realized that everything finished. So there was no social register, you know, that could help in even the distribution of palliative to the right people. They claimed, for example, in FCT, that the distribution, they distributed to people living with disability, you know, and the people with disability asked them, show us the register that you use in your distribution. So the distribution were also tainted with a whole lot of criticism from people. They were made political leaders were the one who were distributing, you know, for their own, you know, people. Even in terms of contracting, you know, they also noticed that it was not fair, it was not transparent, you know, as you would expect. So the spendings there, how much is being spent, people don't know. People cannot even say who got what. It was difficult for us to find that even in communities, you know, people can point out to say this person collected some palliative, this person didn't collect. So the distribution was faulted. There were a lot of corruption issues in that regard. Now, the second issue is the issue of political and financial discipline. There are procedures for procurement. During this period, the research also showed that this was actually not taken into consideration. There was no political or financial discipline, you know, that was made known to people. So our contracts are being given. We saw a whole lot of isolation centers and all of that, you know. And oftentimes when such a thing happens, what you see is that if you have a crisis and procurements are not open, information are not open to people, what it means is that people are benefiting from the crisis. So there are assumptions of people benefiting from the crisis. And the third one is the issue of citizen buy-in. You know, so there is also, as I said, citizens are not carried along. You know, they don't know what is happening. So, and that made some of the conversations around COVID-19 much more. It made it clear to people that this is actually something that is not tested for transparency, you know, and accountability. So, in conclusion, there are a whole lot of things to be noted. Also, in terms of the capacity of civil society, you know, to be able, you know, to monitor at the time when they are needed most. I think because COVID-19 came as a shock, it also met a lot of civil society in that regard. You know, I would have expected that with this whole thing, because a lot of funds have been used in this process. A lot of funds have been used in this process. We can see billions, millions, loans being taken and all of that, you know, and nobody is rendering the account. So the capacity of civil society was also a question in terms of whether we have capacity to be able, you know, to respond to the situation. So by and large, my point is that there's a need to empower the citizens to be able to further hold government accountable. The palliative as it is now, they didn't get to the right set of people, and our research, showed that, clearly. Government during this period lacked leadership transparency, financial discipline, and were not able to meet up with what is expected in terms of principle of transparency and accountability. Thank you very much.
Thank you very much, Doctor. That was really spot on, and you actually did not use up all your time. What I intend to do is this: after our fourth expert speaks, I'm going to go back again to the panel. So just have like 2 minutes to address some of the things, particularly the issues that I'm highlighting now with each of you, before we then open up to general questions. And for Dr. Akiode Afolabi, I want you to look at this issue of social register and your statement that there is no social register, but we've had statements from political office holders to the effect that there is a social register, but that the identities of those on that register cannot be disclosed for reasons of confidentiality. And then in terms of procurement, does the procurement process allow waivers in terms of emergency? And is the point you are making the fact that the process for obtaining those waivers were not followed? Because I'm just wondering how possible it would be to follow the whole process of the procurement as outlined in the Procurement Act in an emergency. So probably you have 2 minutes to just round up to revisit that. May I call on, is Professor Odombana with us now? Is Prof with us now?
No, not yet.
Okay. So we have, well, there's a screen being shared now. We probably will have an explanation about this later, but this is probably from the survey done that our last speaker referred to. I'm sure that someone will speak to it later. May I ask Alanet Silk, Mr. Ebun Adegborua, to come in and let us know if things would have been done better. What are the lessons that we have learned in this era, and what could we have done better? Alanet Silk, sir. Please, can you unmute him? Can you unmute him? I don't think he can unmute himself. All right. Alanet Silk, you have the floor. You are still muted.
No,
Alanet Silk, you are still muted. Right.
Yeah.
Yeah.
Good morning, Prof. And good morning, ladies and gentlemen. I commend the organizers of this webinar and also fellow panelists and Prof who is moderating. Now, we talk about public finance and accountability during the COVID-19 era and also subsequently. I would just want us to realize that from the provisions of Section 80 of the Constitution of the Federal Republic of Nigeria, 1999, as amended, we have what we call the Common Pool or the Commonwealth, recognized as the Consolidated Revenue Fund, where all income and income of the government is supposed to be gathered together for purpose of appropriation. And in that regard, I believe that part of the challenge you have presently is that a lot of funds has been donated for the COVID-19 pandemic by private individuals, organizations, and even foreign donors. But we do not have any record, even though Section 83 of the same Constitution says that there should be an account submitted to the National Assembly where all members of the public can have access upon application. So we have that challenge, and that's why this seminar is very important, so that those who have authority in respect of these funds can make themselves accountable for us to know how much has been received and how much has been spent. For instance, for those of us who are in Lagos State, we are aware that the federal government gave Lagos State 10 billion naira, and organizations and individuals also donated money. But what we see daily in this state in particular is lack of capacity in terms of the testings, in terms of the facilities, bed spaces. So when you talk about lessons that we can take from this, the first is that those who are in authority over us are flagrantly violating the provisions of the Constitution in terms of public accountability, in terms of tampering with public finance, because up to the time we have this seminar this morning, the National Assembly has not appropriated any amount for COVID-19 because the budget had already been passed, you remember, in December, record time, before we had the first outbreak in February. So all expenditure being made, all money being received and withdrawn and expended are being done illegally without approval, by the National Assembly. So that, I think that's the first lesson for us as a nation, that we owe a duty to ourselves and to our generations to hold government accountable, because it's clearly spelled in the Constitution that we ought to appropriate money before it's being spent. The second issue for me is you talk about coping with the health challenges from the COVID-19 pandemic, and what lesson do we take from there? I look at Section 33 of the Constitution. When you go to Chapter 4, dealing with fundamental rights, human rights, you see the priority that the drafters of our Constitution have given to life by making sure that that is the first human right recognized by law. So Section 33 of our Constitution therefore grants the right to life and says that no life can be taken except in a procedure permitted by law. So life comes first. And once there is a pandemic of this nature, challenging that right, because if you become infected and there's no capacity by government to treat or take care, that life is being threatened. So the lesson that we take from this is that it's like to your tent, O Israel. The government has failed woefully to guarantee that right to Nigerians in terms of infrastructure, in terms of adequate hospital facilities. You recall now in Lagos State, private hospitals have been licensed to conduct tests for COVID-19, and the average charge in the minimum is about 50,900 naira to be able to undertake those tests in private hospitals. And you know what that means to the ordinary Nigerian. who is on a minimum wage of 18,000 naira or 20,000. So it's like the right to life is being threatened by the negligence of government, by the wickedness of our leaders who are daily receiving money without accounting for them. Then, of course, you know that the other is that life expectancy in Nigeria averagely is about 51 years. So either myself and even the moderator and Prof and many of us who are listening, we are on borrowed time.
Indeed.
You know, in Nigeria in particular, but by the grace of God. So you see that the pandemic itself has come to endanger the lives of Nigerians the more because of lack of infrastructure. You then talk about insecurity, whether in terms of Boko Haram, in terms of kidnappers, in terms of lack of facilities, power outage, no water. You know, so the rate of the risk to our existence is compounded by this pandemic. So having laid that background, therefore, I would then look at what are the lessons for us as a people. The first is that we should now know clearly that every citizen is an activist. And the reason is very simple. Section 46 of our Constitution has granted the right to every individual to be able to stand up and protect him or herself. Section 22 of the same Constitution has granted the same right for us to hold government accountable in terms of the fund received and how it's expended. And what has happened, as you can see, especially in the life of this regime, is that the government will not do anything unless it is pushed. That's why you see virtually every sector of our life is on strike. Lecturers are on strike, doctors are on strike, even military, who are the police, who are supposed to be on essential service, have also embarked on strike one time or the other. So we should now realize that all of us should rise up and take up the responsibility of holding government accountable for the fund received and also for infrastructure in terms of this pandemic and even thereafter. Secondly, is that for us as a nation, we probably have become our own government. You provide water for yourself, you provide electricity for yourself, and you are forced to pay tax. So it is important that out of this seminar, for instance, we must be able to make a demand on government to know how much exactly has been received in respect of COVID-19 and how much has been expended. Who are the donors? I mean, how can people be addressing press conference every day in the name of presidential task force and they refuse to address the germane issue as to the amount of money received by government and how it's been expended up till now, since February? And I think that's something that we need to take up. Then the other point is that for us as activists, I think we ought to accept the blame on behalf of the people of Nigeria that we probably have not done enough, especially if we compare to what is going on in other jurisdictions, in the United States, in London. Even in the course of this COVID, people are on the street protesting, whether in respect of the death of Floyd or in respect of the capacity of the British government to follow due process. People are on the streets demanding for their rights. So I believe that now that we know that there is no capacity on the part of our leaders, it's our responsibility to take up that constitutional role of causing government to become accountable. Now, the other lesson is in terms of the health challenge. I believe by now we know that it is not correct to say that COVID is not real, given the number of people, at least we know, who have contracted the infection one way or the other or passed on. So we ought to ensure that there is responsibility in terms of what we consume, in terms of dieting, in terms of drinks, and then how we are able to ensure that we get enough resources to take care of our health to be able to cope with this period. Thank you very much for the opportunity to be part of this seminar. God bless you, sir.
Bless you too. Quite succinct and thought-provoking. You again kept to time, and I think I like that, because there's really more to talk about this, and you probably will want people from the floor to signpost it. I would like for you, in your next 2 minutes or less, to tell us really that in terms of grants by the federal government, I think aside from Kogi and aside from Kogi states, all states in the Federation and FCT have posted figures on COVID-19 infections. I'm not sure about the fatality rate. What has determined the flow of grants? To my knowledge, to probably just 4 states. What has determined that? And I don't know, is there a way? We have been told that government has been responsible for treatment of COVID patients. And I'm worried about this 50,000 bill that private hospitals are charging. Do you think that at the very least, government should be able to meet the expenses also of some expenses also of patients that go to private hospitals? After all, this is done under the NHSP scheme. So going to a private hospital does not necessarily mean that you don't want to access public funds. Okay, so we'll go back right to my brother, Mr. Ogundepe. 2 minutes briefly to look into some other aspects, some of the aspects that I've raised, and maybe some things that probably occurred to you after listening to your colleagues. So just 2 minutes to add icing to the cake you already baked. Mr. Ogundepe. Please, can we unmute him? Mr. Ogunsawo, sorry. I beg your pardon, Mr. Ogunsawo. The host will unmute you, I think.
I have done that. It needs to unmute.
Micro, okay, good. Mr. Ogunsawo, over to you.
Yeah.
Okay, here's what I want to quickly add, and that is a wise man once said that he who is poor cannot trust his government. He who is poor cannot trust his government. And so we had looked at the relationship between the poverty rates, the illiteracy rates, and the COVID-19. And today we know that we have millions of Nigerians who are poor.
Right.
And the expectation is that once people are poor, they do not trust the government. And they wouldn't trust the government's news and explanations on if there's a coronavirus, what they should do, because they are poor and they do not trust the government. The other issue is that with poverty comes a lot of other challenges. I think there's some noise in the background here. Okay. So the concern is,
yeah.
So the concern is the trust deficit based on how the government has managed the pandemic. The trust deficit in Nigeria has increased. And I often say that the trust deficit in Nigeria is larger than the infrastructure deficit. People are poor, they do not trust the government. And the government had this golden opportunity to minimize the trust gap. But in the last 12 weeks, we've seen that the trust deficit is growing. And that's why a lot of Nigerians do not believe government's response to managing this pandemic. But the implications will go beyond COVID-19. And here's why the implications will go beyond COVID-19. The most important source of revenue for the government should actually be the tax revenue, taxes that citizens pay, the personal income tax. The oil revenue cannot sustain Nigeria. Nigeria can depend on it. And non-oil revenue would normally become the major source to replace oil revenue, especially personal income tax. And as long as the trust deficit keeps growing, it becomes more difficult for the government to collect the tax from the people. Nigerians will be less willing to pay tax because they do not trust the government. The government has not managed the response to the coronavirus pandemic properly, and so the trust deficit has grown larger. And because the trust deficit has grown larger, Nigerians' willingness to pay tax will reduce in the future, which means that the government will likely struggle with tax collection and encouraging Nigerians to pay tax. That is the challenge of the poor response to the pandemic that the government hasn't really considered. That how easy and how willing will it be for Nigerians to pay tax?
Thank you very much. Thank you. The trust credits and the trust deficits and its implications for citizenship. Dr. Akeode Afolabi, 2 minutes. Dr. Akeode Afolabi, 2 minutes.
Yeah. Oh, all right. Thank you very much. I have 2 questions that I'm supposed to respond to. One has to do with the issue of social register and the fact that the political office holders said that they have social register. Now the question is whether that social register was used, for this COVID-19 intervention, and my answer will be no, because if we look at because if it was used, there is a need for disclosure, especially when there are issues being raised around corruption with respect to who got what, during this period. And we didn't see any of the government officials come to say, well, what we use in Lagos to define who and who got the palliative was the social register. So my point is that there's no clear information with regards to what register was used. And I'm saying this because in one of the our intervention, particularly at the FCT, the people with disability said, if you say you gave that number of people the palliative, what is the evidence to show that you have, a list that we are using that is guiding you with respect to your distribution of palliative? If there was a report by the National Social Register Office in 2019, which talked about the number of states that they have been able to reach in terms of the number of households that have registered on people. And it says about 26 states and Abuja have been reached as of 2019. And it says of all the 3 million people registered, only 3.2% are persons with disability, with various forms of disability. And they did other breakdown to bring the females and all of that. So my point is that this register was not seen as used for this situation. And I think that it would have been better if the register is used so that people know that there is a criteria upon which the distribution was made. And so that's the point I'm making. Now on the issue of which the second question around the procurement law, whether we can there should be a derogation from the normal procurement procedure, during the period of COVID-19. My answer will be no, in the sense that, because when there's a derogation to procurement law, what that opens up a whole lot of whole lot of corruption. Would be such an it would be important for that companies or contractors already, within our systems to bid and compete for the building of facilities or isolation centers. We didn't see that, information on the table. And that's why it becomes very suspect. So that COVID-19 does not become a COVID 419, where people use the opportunity of the crisis and the fact that nobody is following the money, to do a whole lot of corrupt practices, which are not supported, which are not allowed, which are not allowed during the normal period. Although even during the normal period, we all know that there is challenge in terms of government following up with the procurement procedure. So what I am saying in essence is that during that period, it looks like nobody was watching. So in that case, the issue of procurement was actually not put on the table. And for me, I think when we're talking about corruption and we're talking about transparency and accountability, these issues, they are very, very germane. Thank you, sir.
Good. Perfect. Spot on. Thank you very much. Mr. Adegborua needs to be unmuted. Mr. Adegborua is good.
Yeah, it's been done. Yeah.
Thank you very much, moderator. I hope you can hear me now.
Yes, we can hear you.
Okay, you raised the issue of the responsibility of government to offset some of the medical bills that those infected could incur. Indeed, the framers of our constitution had anticipated a moment like this when they made provision in section 83. And I would just like to read it for emphasis. It says that the National Assembly may by law make provision for the establishment of a contingencies fund for the Federation and for authorizing the President, if satisfied that there has arisen an urgent and unforeseen need for expenditure for which no other provision exists, to make advances from the fund to meet the need. So before now, it's been part of our expectation as a nation that we could face some emergency. It could come by way of flood, it could come by way of pandemic, or any other emergency that was not foreseen at the time of preparation of the budget. So it is a matter of the leadership taking the initiative, especially the President and the National Assembly, to create a contingency fund, either from the donations so far received, from well-wishers, organizations and individuals and foreign donors, or from the pool of the Consolidated Revenue Fund, to be able to take care. In countries like Canada, the government will just ask people to stay at home and they credit the accounts of those who have been infected or otherwise are unable to take care of themselves. Section 14 sub 2 sub B of the 1999 Constitution makes it clear that the primary purpose of government shall be the welfare and security of the people. The reason why government exists is to preserve the lives of the people, to protect them, to defend them. And I have never seen any government that will just fold its hand and throw its citizens to COVID the way Nigeria is doing currently. Because if you go around all the states, it's just a matter of the people for themselves. And so I believe that it is the responsibility of those of us who are more well enlightened as lawyers, as activists, to be able to hold our government accountable to ensure that our people do not perish on account of COVID-19. So I agree that the government has a responsibility to take over the medical bills of citizens, the elderly ones, the ones who have no job, and even the ones who have job and cannot have enough resources to cater for their need. We are the enemy of ourselves. It is only now that our leaders cannot travel that they realize that there is need for good hospitals. Otherwise, even in the course of this pandemic, Ghana has built close to 95 state-of-the-art hospitals. And I think that's a challenge for us as a nation. Thank you very much, Mr. Moderator.
Thank you. We are worst enemies, the learner says. I like the provisions you cited in the Constitution. Problem apparently is that no such fund appears to have been created by law. It's debatable whether emergency funds, probably domiciled in the National Emergency Agency, would have been used for this purpose, but maybe that's a question for another day. So right away, we would like to go into the interventions from the floor or from the web, as it were. We can do it this way. You can raise your hand. There is a provision for that on the Zoom platform. If you want to raise your hand, you go to the chat. You go to the chat module, and there's a provision for there, so you can be recognized. Or you can send in your questions through the chat module.
We have Sulaiman Arigbabu and Tijabo raising their hand.
Okay.
What do you? Yeah.
So what we will do, we will take a flurry of questions, and then we will then ask. We'll filter to our panel for those concerned to answer. I think that's the way we will go. So,
okay.
Sulaiman.
Yeah. I think you need to set minutes for contribution of questions to not be more than 1 minute.
1 minute, yes. We don't want another paper. Mr. Shino Dugbemi, I have noted you. We will be with you after this two. Yes.
Yes, thank
Sulaiman,
you, Prof.
Please go on.
Thank you, Mr. Moderator. I think Mr. Suraju should have allowed me to have my way before setting the rules. But now that it's been set. Well, let me thank our resource person for a beautiful presentation. I have just one concern, and I think the senior advocate, Mwade Borua, will be, I'll be directing my question to him. The Lagos State's decision to license some private hospitals to do COVID-19 tests at a price. I am thinking that, is it something that one can litigate against? Because this is like throwing the rest of, knowing the experience that people are having, everyday complaints about how people who have obvious symptoms, who even the layman can conclusively say this is COVID-19 situation, are being turned back at various hospital facilities across the state. And then you now create a special provision for the rich. I mean, this is something that power holding companies, the various discos have been doing, and they have been getting away with it. Now it has come to the level, because it was just about electricity, and we know we could survive that, no problem. But now this is about our lives. And now government is saying the rich can find their way, the rest of us are on our own. So is this something that, is there a provision? Is there an opportunity to use adjudication to bring government back to its senses? Thank you.
Okay, the next question. The next question, we'll take a bouquet of questions and then pause for responses. Mr. Odugbemi.
No.
Tija. Okay. All right.
Okay. Yes. So good morning, everyone.
Good morning.
And thanks to all the panelists for the interesting perspectives. I especially want to get some more insights from Babajide Ogunsanwo on the data analysis he gave us. I'm especially concerned about the data trends emerging from the states. And I would like Jide to tell us or to try to connect the dots between some of these trends he has presented this morning with what's happening at the state level. Because we have, yes, the federal government has not done enough, but if we say the federal government isn't doing enough, then we can say confidently that the state governments are doing next to nothing. So what trends have been emerging from the states? I would like him to elaborate a bit more on that.
Thank you very much. What trends are emanating from the states? Now, Mr.
No, there are people. Before we come to Mr. Ibrahim.
Right, go on.
Okay, good afternoon, everyone. My name is Ibrahim Nuh from Kano. Thank you, the moderator and the discussant for this wonderful presentation. We really enlightened about it. So my question, even though I raised some concern in the chat, but my specific question now goes to the first presenter, where you mentioned that the effect of poverty and level of literacy has. I want you please start to emphasize or to expatiate more about this claim. And this last question is that I just want to show the House that there is a publication in the Nokofo that I shared during the presentation, which I think, as the second presenter made mention, information is key to our tracking processes. So I think this is part of the information that all of us in the civil society need in order to be tracking the palliative distribution done by the government. Thank you very much.
Wonderful, wonderful. That's a very so that was the chart you shared earlier.
Yes.
Oh, good. Thank you.
Yes.
Much obliged. Thanks for that information.
Welcome, sir.
The one, Suleiman.
Thank you, sir.
Okay, thank you, and thank you to the panelists too. Just my question is to Prof, the moderator, sir, Professor Deji, as well as Dr. Abiola. Dr. Abiola, in your presentation initially, you were very concerned that the issue of social register, that we don't know exactly those who were given palliatives. And when Professor Deji later raised the fact that they were giving excuses of issues of privacy in not disclosing the exact identity of those people. So correct me if I'm wrong, I feel that you agreed with that at least they should just say, okay, we use a particular social register. But I think that the issue of disclosing in exactitude those who benefited from the palliative is not violating any privacy. So except maybe you want to start saying that the FY Act that asks public institutions to disclose salaries and all that, maybe there's a privacy that is violated. Nobody is embarrassed. This is just a general issue. I don't see a privacy issue. So I don't think we should accept the narrative that if the details are disclosed in exactitude, that will be violating privacy. I just want to hear more from you on that. Thank you.
Thank you. So, Mr. Odugbemi.
Mr. Odugbemi, you need to unmute yourself.
You have been unmuted from this end. Yeah.
Okay, I really must thank our panelists, Dr. Akiode, the elder son, Ebun, Adegurua. I can also spot Mr. Femi Aborishade, though I've not heard from him. But you see, my main concern here is this issue of trust deficit. The truth is that money has been spent both for the victims and even the committee, federal government. So here and there, money have been spent. Now my question goes to Ebun, the SAN here, and I want Mr. Aborishade to add his voice. Is there a role that the FOI can play in this? We have litany of questions. Can we, as civil society, put down all these questions and use the, invoke the FOI to ask the panel, what have you spent? Who spent what? What did you spend on the victim? What did you spend on the panel itself? So I am asking from my end, what is the role of FOI in this thing? Can we invoke it to ask the committee questions in areas that are gray? That's my FOI in this business.
Thank you very much. Can we allow our panelists to weigh in now?
Yes, sir.
So we have questions. Let me just rehash. For Mr. Adegurua, can we litigate refunds of expenses in private or public spaces? And also the issue of the trust deficit, asked by Mr. Odubemi, whether this is an issue of the FOI for the FOI Act. I will ask the organizers, Heather, to share the recording on the first seminar we did, webinar we did. I think some of the issues there, Mr. Odubemi will find quite beneficial. For Mr. Ogunsanwo, question was really about what is coming out from the states. What is coming out from the states, whether we're really getting the proper thing. And also for Ode and for myself, well, you really don't ask moderators questions. Unless moderators want to waive, unless moderators want to waive immunity.
The right and the immunity.
Unless they want to waive the immunity. But I will just let Dr. Akiode have a shot at it. I think she explained really, I just supplied information actually about the existence of a social, and her input was that it wasn't used. Even if there was one, it wasn't used. Whether the claim about disclosure is valid or not, we have to test it. That is really my view. It has to be tested. And I won't really say more than that for now. So let's have it first from Mr. Ogunsanwo. Your response.
Okay, Mr. Ogunsanwo first.
Yes,
First
Mr.
one.
Ogunsanwo first.
Okay.
There is a screen being shared now. Is this for us?
No, I think this is Mr. Odubemi. You need to check. I think you're the one showing your screen. Mr. Odubemi, can you stop sharing your screen?
All right.
Yeah.
Mr. Ogunsanwo, you have 3 minutes or less.
Thank you very much, Prof. I'll speak to the first of the two questions. What trends are coming from the states? The most important thing we have is that today we have 15,729 active cases. 57% of today's active cases are located in Lagos State. So more than half of the active cases in Nigeria today are located in Lagos, which means that Lagos State has significantly done more tests than any other state. That's the first thing. We have other states like Oyo, the Federal Capital Territory, having done some samples, but significantly, almost every state in the country in Nigeria is under-sampled. There's some information, apart from speaking to the challenge, let's speak to some of the solutions and what we expect, what sort of data we expect to be coming out from the states to improve the understanding of coronavirus. We need to have, in each state, you need to know what samples have been taken in each local government. The states have to provide information on the gender of those that have the coronavirus in each local government. We need to know the income category of those that have the coronavirus, because they allow states to plan and know which income sector are being affected by the coronavirus. We need to know the employment status of everyone per local government that has had the coronavirus. Are they employed? Are they underemployed? Or are they unemployed? We also want to know what sector, if they are employed, what sector do they belong in? What's the educational level and qualifications of those that have had the coronavirus per local government? Is it primary school certificate, living school certificate? Is it junior secondary school certificate? Is it a master's degree? Is it a bachelor's degree? That information is important. We need to understand the living conditions of everyone that has had the coronavirus per local government in Nigeria. Do they own the property they live in, or are they renting out? These are the sort of data that allows states to plan the coronavirus. In Nigeria today, there's no state that has publicly provided this information to stakeholders and civil societies, and clearly shows that no state is prepared to manage the coronavirus in Nigeria. Speaking to the connection between poverty and literacy, because a lot of Nigerians and families living in Nigeria are poor, especially in the north, they do not believe what is going on, so they are not taking tests. And that's why the evidence today shows that most of the tests that have been taken regarding the coronavirus, significantly most of the tests are located in the southern region where there's lower poverty and there's lower illiteracy rates. The reason why a lot of poor families are not taking the test is, first, is they don't believe the government, they don't trust the government. And secondly, is that there are a lot of things that have been killing poor families in Nigeria, even before the coronavirus, that the government has not adequately responded to. So a lot of poor families are faced the challenge of malaria, they face the challenge of diarrhea, they face the challenge of typhoid fever, they face the challenge of polio, HIV, and the government has not responded adequately to their needs. In other words, they've had to solve most of these challenges by themselves. So there comes a coronavirus that has killed in Nigeria 616 people, less than 1,000 people, and for them, the government is going haywire. The evidence shows that every 3 days in Nigeria, 1,000 people die of malaria. So while the coronavirus is important, let's not forget that there are many more other illnesses and diseases that are killing millions of Nigerians before the coming of the coronavirus. And so families in Nigeria, a lot of families, based on the evidence we have, do not trust the government and they're not willing to be tested.
So would you say, for instance, that this is giving governments an opportunity, I mean, based on whatever efforts that are being done to cushion expenses under this COVID? Do you say it's an opportunity to look at those other elements?
It's an opportunity, but it's an opportunity missed. I think it's okay. It's an opportunity, but it's an opportunity.
A missed opportunity.
It's a missed opportunity. A lot of state governments, the sad thing is not that a lot of state governments were not prepared. Yes, they were unprepared. What is worse is the unwillingness to prepare. So being unprepared is given, which is seen, but it's now a new phase is what we are seeing, and that's the unwillingness to prepare. And the unwillingness to prepare is when state governments do not provide such information to the public. Samples taken per local government, gender of those that have had the coronavirus to be made public per local government. We don't need the names, but we need to know what income category in society do they fall in. Lower income, middle income, upper income. Are they employed or unemployed? What career are they in? What sector? What's the educational qualification and level? What living conditions are there? And I state, There is none of the 704 local governments, none of the 36 state governors that have released this information. And I guess it's because they do not even have this information.
Thank you very much. Thank you. A missed opportunity and an avalanche of statistics. What a shame. Dr. Akiode, your beats. Can you respond to the questions from the floor? 3 minutes. Micro for Dr. Akiode.
Okay, thank you very much. Eda, maybe next time you make us a co-host so that we can mute and unmute ourselves. Yeah, thank you. I think that there are about 2 or 3 questions I will quickly want to respond to. One of the questions that was raised is the issue of information, which my brother from Kano raised about the need for us to have information, and he had shared some links up that we need to look at. But I also want to say that there has been inequity and inequality in the access to information that people are getting. Not everybody would be able to check and track from the source that my brother from Kano had mentioned. From what my brother always said, the number of people who cannot read and write in Nigeria is quite enormous. So there must be other creative ways. So my point is that what this is also raising for us is also the need for strategic thinking, because COVID-19 is going to be here longer than we can imagine. We're already going spiritual about it. So my point is that we need to address the question of inequity in information, because information is quite important and critical at this point in time on how people can deal with the pandemic. If we don't have the appropriate information, we're likely going to get into the crisis more and more, and it might be very difficult for us as a country, to be able, to come out, from it. So we need to look at the issue of inequality in that regard. Now, the second question was the question about the social register. I didn't agree by my response in any way that the government has a good response by saying that it is because of confidentiality. I can't see any excuse that the government will give by not declaring to us who got the money and then hide under confidentiality or privacy of the citizens. People are saying we didn't get. So let us know who got and who didn't get. And I think that's why SERAP is asking the federal government and Central Bank of Nigeria to provide spending details of public funds during this period. And they're also asking that they must also provide those who benefited, from these processes, including vulnerable people, people with disability, who did they make cash transfer to, and all of that. I think that we need this information in going forward, on this issue of COVID-19. Now, having said that, I think it's also important for us to understand that there's a nexus between governance and development. At times, it's a question of garbage in, garbage out. Situation around anti-corruption in Nigeria was not at its best before COVID-19. So what we can only see is the kind of things that we see. And there's a tendency that if we don't increase our noise level, people will take advantage of COVID-19, enrich themselves, and just as my brother Adegboruwa said, a whole lot of Nigerians will die for no reason, because of lack of governance. So we must also be creating that nexus, that linkage between electoral transparency and fiscal transparency, so that as we move forward, there are elections that will take place in the coming period. If our election continues to go the way it is going, we will probably keep having this kind of, occurrence of a leadership that is not transparent, that is not responsive, that is not inclusive, that is also just looking at, taking advantage of these people at every point in time that there is an emergency here and there. Thank you, sir.
Thank you very much. Thank you. I mean, really clarifying issues there. The next bouquet of questions go to Leonard Silk, Mr. Adegboruwa. Please, you have the floor for 3 minutes.
Thank you very much, sir. First of all, is the issue of whether we could take the responsibility upon ourselves as activists on behalf of Nigerians to litigate upon the responsibilities of government in terms of the fund relating to COVID-19. And I believe that Dr. Kayode has substantially now answered that in her response. Now, the point I'd like to add to it, however, is that our leaders have a responsibility to understand the concept of social contract. In a civilian regime such as the one we operate now, nobody is forced to seek public office. You must get a nomination form. You even have to pay for it. So the issue of service on behalf of the people in office now is voluntary. Nobody pushed you to put off yourself to say, I want to be a governor, I want to be president. So having taken up that responsibility, you must appreciate the enormity of the roles that you need to play to people when you get to the office. And that's why we must hold them accountable. They are holding power in trust for us. And so it is okay for us to take up a suit to ask the federal government to account for the money received. And we can do this because there is precedent, which we have already. Justice Oguntoyinbo of the Federal High Court delivered a landmark judgment in the case of Serap, whereby she gave imprimatur to the fact that former governors who are earning pensions in multiple forms, either in the Senate, either in the House of Representatives or other public positions that they occupy, ought to account for the legality of their action. And that was taken up by Serap, and there's a decision on it. Also, Professor Obiozo delivered a landmark judgment in respect of the issue of the contrast in the power sector reform, directing the minister to account for the companies that are benefited from the trillions of naira that have gone down the drain in respect of the power sector. So we can leverage on such experience to be able to get the federal government to account for COVID-19 funds. In respect of the question by Comrade Odugbemi on Freedom of Information Act, we're dealing with federal agencies. Now, infectious diseases is within the exclusive legislative list. Quarantine and matters like that, that's why you see the NCDC taking charge of issues relating to COVID-19 generally up to this moment. So the Freedom of Information Act is an enactment of the National Assembly. We have not had any major issue in enforcing it over federal agencies in respect of matters relating to federal revenue. The challenge has been the states who have been resisting the enforcement of the Freedom of Information Act if the House of Assembly of that state is yet to pass a law incorporating the FOI Act in their states. But as it is now, we can legitimately use that act to demand for transparency and accountability. Secondly, also, like I said earlier when I gave my first presentation, Section 84 of the Constitution allows the Accountant General to be able to audit the income of the Federation and submit a report to the National Assembly. And all of us, as public individuals and citizens, have a right of access to those accounts. In trying to conclude, Mr. Moderator, I must say that we should not take this webinar as just another opportunity to listen to ourselves. We must take the resolutions from this into action. Either all of us as citizens or other organizations should begin to file an action in court. By the time I challenged Lagos State on the environmental sanitation law, on the toll gate collection, there was no precedence. I didn't have any single authority in law that I could consult. But I just felt that it's unfair for you to lock up citizens 3 hours, for you to be collecting money from citizens who pay you tax to build a bridge, and the court upheld it. So we should challenge our government on behalf of our people. Thank you very much, sir.
Thank you. A call to arms, litigation, public interest litigation, even legislative advocacy. I mean, what you mentioned in terms of infectious diseases and also contingency funds. Our National Assembly has been sleeping since 1999 on this, and nothing exists now in terms of these two. Thank you. Now we take another round of questions. Can we, Mr. Suraj, can you help us?
Well, I've not seen, I know that Mr. Odubimi mentioned Mr. Femi Aborishade, which I have unmuted if he's available to make a comment briefly. But I think we're almost running out of time. We're supposed to leave here at 1 o'clock. We've just got 8 minutes to go. But I would just want to say that I think this has been very useful. Okay, we have Mr. Aborishade. Okay, can we have him make a brief comment, and then I would make the final contribution and
good. Thank you. Mr. Aborishade, you have the floor for a minute.
Thanks very much for the opportunity to have an input in this program. And I think that the question to which my attention has been drawn has to do with the use of freedom of information, particularly to obtain information on COVID-19 funds. Well, that question has been partly answered. The challenge I want to throw is that we should, as citizens, also endeavor, citizens and organizations also endeavor to do our own work, which we have been doing, but we need to do more. I have, for example, tracked funds that have been mobilized by the federal government, excluding donations by the private sector. And they have mobilized nothing less than 40 trillion naira, equivalent of $104 billion in the name of COVID-19, contrary to the 2 trillion they are talking about in terms of the economic stimulus program. Now, my challenge is this. It is good to litigate, but if we litigate and we are successful in the process of using Freedom of Information Act, unless we back up even the court decisions with concrete actions in the streets, it will go to no issue. It will amount to nothing. It will amount to effort wasted. Therefore, I am challenging us as citizens in our various organizations to come together and insist that the funds raised in the name of COVID-19 must be used for the benefit of the Nigerian people, particularly in the area of upgrading the healthcare system in the country and declaring free medical care along the line of criminalizing medical tourism.
Thank you very much.
Unless we do this, the funds raised in the name of COVID-19 will be concentrated in the hands of a few. Concentrated funds in the hands of a few mean that power will be concentrated in the hands of a few. Concentrated power in the hands of a few would facilitate political capture. Political capture would lead to economic and political exclusion. Let us do more in terms of insisting that government must use the funds raised in the name of COVID-19 for the benefit of Nigerian people, particularly in the area of healthcare. Declaring healthcare as free in Nigeria should be the minimum gain we should make out of the pandemic that we face. Thank you.
Thank you. Thank you. Very, very thought-provoking contributions. Mr. Suraj.
Yeah. Thank you very much, Prof. And I would want to thank everybody, all the participants, our panelists, Mr. Babajide Ogunsanwo, thank you very much for being on this. We're not in the least disappointed by the, not just data, because that is also part of the thing that we meet around this climate. You know, we push out data thinking that we're pushing on, and people are unable to translate the data to information, but you succeeded in doing better than that by giving the data and also translating its information, leaving us with the challenge of then using those information for the necessary advocacy and campaign that is important for taking the advocacy to not just the national level, but sub-national levels in terms of building people that are entrusted with power, responsibility, account. And the test deficit issue, I think it's a very important one. And for us at HEDA, seriously speaking, and for those that will be interested, we will work with you, hopefully, actually conduct a survey on actually the people's trust in government. We should be able to determine that, you know, trust level, and then challenge government with the findings. Also call for reforms along that empirical evidence that will emerge from such survey and findings. I thank you very much on behalf of the organizers for presentation and presence as well. The same goes to my friend, my brother, Lanetic, Big Sam. Thank you very much for your, not just this presentation, but also for taking the lead in some of the activities and actions of challenging people in power and also holding them to account. We really salute your activities and actions around the environmental issues that you mentioned, and also the toll gates. And we would more than be happy to work with you, because I can see that it is like my colleague Sulaiman said, it is not just like creating a separate channel for the rich and the elite by creating, you know, private testing centers. It is also creating the room for corruption. So you would see in the next couple of weeks, there will be inadequate test kits at the public institutions and facilities. They would be diverted to these private hospitals, you know, that would now be charged for the tests to be conducted. You would now see with the scarcity at the public also institution, charging illicit, you know, money and also costs for people to conduct the test, because once they create the scarcity, then they also create, you know, the need for people to want to bribe and then also pay token to get the test conducted. And this is not something that we should in any way do. And this is what we challenge the government, especially the Lagos government, with all the resources and amount of money that is being donated in the state, that we don't even have an account for the utilization. I think it will be a test case for all of us as stakeholders in Lagos State. Thank you very much for my sister and the board member of HEDA Resource Center, Dr. Ola Akeodia. Thank you very much. I mean, you've done extremely well in terms of bringing the gender perspective that is really much needed to some of the advocacy for accountability, transparency, and even participation in governance. So we recognize the brilliant work that WOTC is doing. We're happy to partner in this progress, and we hope to also not only work with you on the gender issue, but also for all the other vulnerable people. We tested and what these have done to quite a number, and they are the worst hit victims of the COVID-19, either by direct impact or indirect impact. The people with charges are the ones that would feel the impact more, and they are the less considered by our government officials. So we also thank you for coming around. For our brother, Comrade Femi Aborishade, thank you very much. And we'd also really love to look at some of the information that are available in terms of the contribution. We know there are quite a number of, you trust Nigerians, quite a number. Hush Puppy, like one of my friends just said, is one of the all 419s around. Most of the corporate establishments in Nigeria actually 419s. They made announcements of contributions, but it never went beyond that contribution on the newspaper. It hasn't translated into the redemption of those pledges. So there's quite a number of all that are going on. But then we should take an opportunity of challenging both them and governments that are collaborating with them to actually live up to their talks. To all our participants, panelists, my colleagues at HEDA, thank you very much for your presence, participation, audience contributions, questions. We look forward to doing more of this nature of engagement until we have a government or we have a system that is functional, that we all can be proud of. We promise to consistently take up on some of these responsibilities with your collaboration. Like you mentioned, Dr. Abiola, we have attempted to make our panelists co-hosts in the past at one of the sessions. So one of the panelists actually complained that she really doesn't appreciate it because there are requests to enter messages that are propping up on the system, and not everybody is comfortable with that. So we have to change the strategy not to actually make everybody co-host again, so that we don't keep embarrassing our resource persons. So on this note, I thank you very much. We look forward to calling on you very soon again to take some of the findings and also recommendations here forward. But for us, we're going to practicalize and put to practice in terms of concrete intervention some of the recommendations that you imagine from here. I thank you very much, Prof, for your guidance, for erudite, moderation, and also your consistency. Thank you for guiding us on this behind the scene and on the scene yourself. Thank you, Professor Deji.
Thank you. Thank you. It's been a wonderful event. God bless you all. Bye-bye.
Bye.